I'm Dr. Gaudet with Resiliency Brain Health here in Coppell, Texas. We're going to speak today about Virtualis. Our Virtualis equipment is our VR device, and we use this every day in clinic. So we use this for testing all of our patients for their vestibular systems and their balance issues. And then once we do the testing, we can create a program for them in order to help during therapy utilize this equipment as well. So what we're going to look at here is we're going to look at Kat, who is going to be performing the SOT test. So Dr. Eisenmann is going to put on the VR goggles for her. And patients with glasses or any corrective lenses can use this. The goggles are large enough that they will fit over almost all lenses.
You do want to try to make sure the patient's hair is down.
Yeah. So getting a good fit on this is very important in how they will be able to, or how they will perform during testing.
Feet have to also be in place.
Yes.
And they are.
And so there are marks on the force plate in order to have correct alignment with each and every patient's feet. And so we actually spend a few minutes with each patient with their goggles off so they can see where their feet placement are before we put the goggles on to make sure that everybody is in correct position. This test is very quick. It does not take a long period of time. However, the force plate does move. So when you're working with patients with this, you want to make sure that they feel safe and secure and that you have their hand rested on the rail or here so that as the plate moves, they do not lose balance.
All right, we're going to start condition 1. So eyes open and let go of the ring, okay?
When you're completing each one of these, you can do as few as one trial in each area, or you can do multiple trials in each area depending on your clinic and what information you actually want to collect. Their instructions are given to the patient from the testing person. They're also given to the patient through the earphones that are on the goggles, on the goggles as well, so the patient gets to hear it multiple times. There are times where you're going to want to have the patient with their eyes open and times where you want to have them with their eyes closed. So when the patient is testing in an eyes closed environment, you want to make sure that you're actually facing the patient as opposed to the computer. And that way, if the patient does start to lose balance or is having any challenges, you're there to support and or catch them.
Condition 3.
Walking the patient through each one of the instructions, again, they'll hear it in the headset, but they'll also hear it from us. That way, they hear it twice, and there are no surprises. Our goal is never to surprise them with the headset on. We forget sometimes that that patient cannot see what's going on in the world around them. And if they do get startled, and you're standing too close in proximity, they could reach out and touch someone.
All right. You ready? Condition 4, normal vision, eyes open.
When we're on these different conditions, now we're telling them that the plate will start to move, and we want to make sure that we're guarding. That way, if they should lose their balance because their footing is not stable, that there is someone there. And we also verbalize to them that the plate is going to move. We're here if you need us.
We're going to do condition 5, eyes closed when you're ready.
And that's a great example of why we guard and stand. Just giving a patient contact oftentimes is all they need to bring themselves back. And then we can mark it as a fall on the screen.
Okay. Am I okay? No. Okay. Now last one, sway reference. Hands to your side. I'm right here. Cue that cerebellum.
Don't make me laugh.
Sorry.
It's my balance.
Okay.
Okay. All right. You good? Mm-hmm. All right.
And at the end of each one of these tests, you have your patient put their hands back up on the platform so that when that platform moves again, they have a center of reference or a point of reference for the movements. So the next part of this is us actually performing therapy. We've completed the testing, we have a plan together, so now we're going to move into therapies with this.
Okay, so I'm going to get it started. This is going to be target tracking. You're going to be moving your head. You're going to see some green arrows, and your head is going to move to try to get some flies. Now, when you feel comfortable, you're going to be able to take these hands down. So eventually, we only want cervical range of motion. Okay.
So now we've given all the instructions to the patient, so they feel comfortable with what we're doing. And as we press start, and we cue the patient, now is the time to remove your hands, and that we've cued the patient that this is a cervical range of motion. So we only want them moving their neck, not their body, to find the targets that they're looking for at this point. Each one of these targets require her to move and hold for specific periods of time. You can shorten that or lengthen that as needed. You can also give the patient cues. So there's some visual cues in there. So when they're starting out, most patients need many cues to figure out where they're going and what they're doing with this therapy. But as they've performed it a few times, you can start taking away the visual cues and let them actually spend the time finding the targets that they're looking for. So for the next therapy that we're going to work on, we're actually going to work balance. So this patient is going to be required to keep a ball in the center of the screen. However, the platform is going to move randomly. So she is going to have to, one, anticipate that movement, and two, then respond or react to that movement accordingly. You can also change the speed of this. So the intervals between the movements are shorter or longer, and you can have these actually be you can change the degree at which they move, so you can sharpen or lessen the degrees. So there are many different types of memory games that we can also do on this. Some of them require upper limb, and some of them require lower limb. So this is a memory game, and it requires lower limb and balance. The patient is going to move a target over a card, and she has to hold for a period of time in order to get the card to flip. Then she has to move to a different card to get that to flip and see if those two match. So for this one, the patient is going to hold a controller, and they're required to take the loop and pass it over a pipe. And should they actually touch the pipe, there's a little bit of a vibration that happens. And so they have the opportunity to have that immediate feedback to know if they are actually following in an appropriate manner. This is part of the upper limb mobility that we work with.